My current role is as Senior Policy Advisor to Governor Mark Dayton and Lieutenant Governor Tina Smith. And really my job is to work with all of these different constituencies to advance the governor's Health and Human Services policy agenda. Starting in the School of Public Health, the Maternal Child Health Program allowed me to take a broad swath of classes around community health issues, women's health, children's health issues. I took a class called Legislative Advocacy, where I had the opportunity to spend a legislative session with the Children's Defense Fund, and they were working on a bill to expand Medicaid coverage for children, so low-income children, and see how that process worked and what it meant to really translate research into policy, how lawmakers needed to make the arguments for their policies, both from an economic perspective as well as a health perspective, and I'm really grateful for that experience. My current boss, Governor Dayton, always says is that compromise means agreeing to things that you don't always agree with, and I think that's a lesson that I always come back to is, that a lot of times in order to get things done in public policy, you have to really be willing to agree to some things you don't agree with in order to have the bigger picture and the longer game in mind. The most gratifying things that's happened recently for me was to have the opportunity to begin teaching a class in the School of Public Health, and it's focused on children's health policy. And for me, I feel like being able to teach that class, I am able to sit in a room and sort of see a room full of former me's, people who are interested in really making the world a better place, improving health, and trying to make research relevant to policy and relevant to the real world. If I were to give advice to students who are in the School of Public Health today, I would say that if folks can stay optimistic and be willing to make strong arguments and foster coalitions and collaborations, we'll have a good future ahead of us in public health.